Patients should see a physician for hip pain when they think they should, and that changes for every patient. Typically when they start to have interference with activities of daily living, pain, or limitations with sleeping, or general crabbiness. Most common locations for hip pain depends on really where the problem lies with the hip. Certainly the most common areas for pain related to hip arthritis, number one would be in the groin, number two, typically in the back, typically where your wallet would be in your pocket, or sometimes it'll be referred down the front of your thigh. Other causes for hip pain such as bursitis may be on the outer part of the hip, the area that you would lay on. Typically that's a presenting symptom or complaint for patients that they don't sleep well at night. That's more of a bursitis. And the other area that's very common would be either the hip flexors, which is a muscle in the front of the hip, or what's called the iliotibial band, which is a tough band of tissue that runs from the side of your pelvis all the way down to the side of the knee. Treatments for hip pain vary depending on what the diagnosis may be. May be anywhere from some generalized stretching exercises to injection therapies, physical therapy, or even surgery. Trying to get patients back to favorite activities certainly depends on what their diagnosis would be or the intended treatment. It may be as simple as physical therapy, stretching exercises, injections, also may be surgery. But the best way to try and get patients back to that type of activity would be to talk to their surgeon or talk to their doctor about how to safely return or how to get them back to be able to participate in the best way possible.